Assessing body temperature. Good day, learners. This presentation will deal with assessing a person's body temperature and will assist in your preparation for clinical assessment. Body temperature indicates the difference between the production of heat and the loss of heat within the body. In Southern Africa, we measure the body's temperature in degrees Celsius. It is important to note that most healthcare institutions have removed or are phasing out thermometers with a mercury bulb. Purpose. Assessing body temperature is a generic basic nursing care standard to be mastered by all learners. All learners skilled in this standard will be able to establish baseline data for body temperature, determine changes in the patient's temperature in response to interventions and treatment, and to monitor patients who are at risk for imbalanced body temperature. Specific outcomes. Learners who have been assessed and found competent in assessing body temperature will have achieved the following specific outcomes and will be able to assess body temperature accurately via the oral, tympanic, temporal or axillary sites. Use all thermometers correctly without injury to the patient. Prevent the transmission of microorganisms to others and the environment. And interpret temperature readings and record and report findings correctly. Embedded knowledge. Embedded knowledge represents what you as the learner has to understand and be able to explain in the area of learning and at a particular level. You as the learner should have mastered all the theory related to body temperature, as well as metabolism. You should have sound knowledge related to the anatomy and physiology of the skin and circulatory system. You should understand the medico-legal aspects related to assessing and monitoring body temperature. And you should have attended a demonstration in simulation on monitoring body temperature using the various methods. Range statement. Assessing body temperature is a generic basic nursing care standard and learners can be assessed in their field of learning in line with subject matter expertise. Procedure. The procedure will be performed according to the nursing process. Assessment. Identify the patient. Greet the patient and introduce yourself. Ask the patient to state his or her name. Check the patient's name and identification number on the patient's identification bracelet. Compare the patient information with the patient's records. If the patient cannot identify him or herself, verify the patient's identification with a second staff member who knows the patient as a second source. Explain the procedure to the patient and obtain the patient's permission. Check the physician's order or the nursing care plan for the frequency to monitor body temperature. More frequent measurements may be appropriate based on nursing judgment. Appropriate nursing diagnosis may include the following: risk for infection, hyperthermia, hypothermia, risk for imbalanced body temperature, and ineffective thermoregulation. Assess the following factors that could influence body temperature: age, exercise and activity, smoking, medication, stress, illness and diseases, environmental temperature, and hormonal influences. Determine the appropriate site to be used for assessment of temperature according to the patient's age and condition. Temperatures differ in various parts of the body. The body's core temperature is higher than that of the body's surface temperature. A core temperature is measured at either one of the tympanic sites or the rectal site. A surface body temperature is measured at the oral, temporal, and axillary sites. A temperature should not be assessed at the particular site under the following conditions: the oral site, babies and young children, a patient whom is unable to follow instructions, a patient that has a mouth condition or injury, a patient that has a wound from a mouth or nose operation, a patient that is short of breath, sneezing or coughing, and a patient that smoked, ate or drank within 15 to 30 minutes. The axilla sites, a patient that has showered or bathed within 30 minutes. The tympanic sites, a patient with ear aches or drainage. The temporal sites and forehead, a patient that has showered or bathed within 30 minutes. A patient that has exercised within 30 minutes. Please note that the rectal site is seldom used for the assessment of temperature, and therefore the rectal method will not be demonstrated in this presentation. Planning. Assemble the following equipment before implementing the procedure: an appropriate thermometer, disposable probe covers if required, patient's vital signs record or control chart, clean gloves, a kidney bowl, and tissue paper or paper towels. Always ensure that the electronic or digital thermometer is in a working condition beforehand. When using an electronic or digital device, always refer to the user's manual and familiarize yourself with the specific device before commencing the procedure. Implementation. Perform social hand hygiene. Provide privacy for the patient if required. Confirm the patient's ability to assist you with the procedure. Put on gloves if expected to touch bodily fluids. Cover the thermometer with a protective cover if required. Place the appropriate thermometer according to the site selected. The tympanic sites. In this demonstration, we will make use of an ear thermometer. Switch the thermometer on and wait for the indication that the device is ready to use. Pull the pinna slightly outward and upward. Point the thermometer probe slightly forward towards the eardrum. Insert the probe slowly, using a circular motion into the ear. It must fit snugly in the ear canal. Press the start button and wait for the indication that the reading is complete. The oral site. In this demonstration, we will make use of a glass thermometer. Ensure that the patient did not recently eat or drink a hot or cold beverage. Place the thermometer under the patient's tongue in one of the sublingual pockets. Kindly ask the patient to close their mouth around the thermometer without biting on the thermometer. The temporal sites or forehead. In this demonstration, we will make use of an infrared scan thermometer. Ensure that the selected skin area is dry and moisture-free. Switch the thermometer on and wait for the indications that the device is ready for use. With your dominant hand, place the thermometer over the selected skin surface, approximately 2 cm away from the skin surface. Press the start button. Keep the thermometer steady in one place and wait for the indication that the reading is complete. The auxiliary sites. In this demonstration, we will make use of a digital thermometer. Ensure that the suitable armpit is dry by patting the area with a tissue paper. Dispose of the tissue paper correctly. Place the thermometer in the patient's armpit. Ask the patient to keep their arm tightly against their body until you remove the thermometer. Press the button and wait for the indication that the reading is complete. Different thermometers have different time frames and speeds in which they provide readings. When using a glass or disposable thermometer, you should wait 2 to 3 minutes when reading via oral and 6 to 9 minutes when reading from the auxiliary site. Electronic and digital thermometers will indicate that the reading is complete with a flashing light or beeping sound. Remove the thermometer. Remove and discard the protective cover or wipe the thermometer dry with a clean tissue. Read the temperature immediately. Switch off the digital and electronic thermometers after use. Clean reusable thermometers and discard disposable thermometers according to the internal policy of the facility. Remove gloves if any were used and discard thereof according to the internal policy of the facility. Perform social hand hygiene before leaving the patient's room. Ensure that the patient is covered and comfortable. Kindly thank the patient for their assistance. Place the call bell and other necessary items within the patient's reach. Evaluation. The expected outcomes are met when the patient's temperature is assessed accurately and recorded immediately on the patient's vital signs record. Record keeping. If temperature reading is obtained from a site other than the oral route, document the site used along with the measurement. Record the temperature on the patient's vital signs record or control chart. Compare the reading with the previous readings and baseline data. Report any abnormal temperature readings to the registered nurse. In conclusion, it is important to indicate to you that the healthcare giver is an important role player in the monitoring and treatment of a patient. Whenever patient care is provided, adherence to infection control guidelines is needed to ensure that all care is safe care. Perform your tasks as per this lecture and to the best of your ability, always keeping in mind your scope of practice.